Hello, hello, everyone. Welcome, welcome, welcome. Today, we have such an awesome treat for all of us and for me as well, because we have with us, awesome hypnotists so that we can have a conversation about hypnosis, about hypnotherapy, what you can achieve through hypnosis, through hypnotherapy. What is this all about? Everybody's curious, right? We go into a party or a meeting of some type, and everybody asks everybody else, hey, what do you do for a living? And everybody has regular occupations. We don't. We're hypnotists. And when we say to people, yeah, I'm a hypnotist, everybody gathers around us and they want to know everything about what, is it true? Is it not true? Does it work? Does it not work? Can you make me bark? Can you make me quit smoking? I mean, it's just one of those things where everybody wants to find out everything they can about hypnosis. And today it's our lucky day because we have awesome hypnotists with us, and we're going to be asking them all of those questions and more. And together we're all going to learn. I also practice hypnosis. I've been doing it for 29 years. This is my 30th anniversary, actually, in November. And I'll turn 30. So I may add a comment here and there, but we're here today to celebrate the work of Eugene, Lawrence, and Patty. And Patty, for one, I have met Patty when I first started working. So I've known Patty literally for 29 years. And Patty, everybody in the profession knows Patty, Patricia Scott. And she is regarded as the reference, as the go-to person. Whenever we all have a question about hypnosis, we all call Patricia. She's the one to go to because she's been around. She knows what she's doing. She's a teacher. She's a teacher of hypnosis. She has a school of hypnosis. She does lots of medical types of application of hypnotherapy, but I'm sure she does other things as well. She's going to tell us what she does. But one of the things that I really appreciate about Patricia is that she's a fantastic teacher. I have taken her classes, and she has shaped my practice to a large extent. So Eugene has impressed me quite a bit. I met Eugene a couple of weeks ago, I think, and we started talking. And last week he was on the program, and Eugene asked the most fantastic questions. He was the skeptic last week. He was listening to us and offering sharp questions that really made us all think more sharply about what we're talking about. And I really appreciate you, Eugene, and I'm looking forward to more greatness from you today. And today we have with us Lawrence. Lawrence is a hypnotist. Lawrence and I met recently, but I read a little bit about him, and I'm so looking forward to getting to know him. And we're in the same profession together, so in a sense, it's like we share a very special bond. I think we all do. We feel that feeling because what we do is kind of unusual, right? So it's kind of awesome to be in your presence. Thank you so much. Thank you, Patricia. Thank you, Eugene. Thank you, Lawrence, for being here. Let's get into a conversation. I want to ask Patricia a quick question before we get into a more thorny question, and that is, Patricia, I heard you're going to be doing a couple of special classes at the IACT convention. What is the IACT? When are you going to be there? What are you going to teach? And most importantly, can non-hypnotists attend? If a non-hypnotist wants to come over and meet you and take your class, can they go? Can you tell us a little bit about that convention?
Sure. IACT is the International Association of Counselors and Therapists. And a few years back, they combined as a sister organization with the International Medical and Dental Hypnotherapy Association, IMDHA. I was a member of both before they combined. It's been quite a few years now, but they wanted to keep them separate because they have kind of separate focus. So they do a combined conference in Orlando, Florida. The last few years it's been in Orlando. And anybody can come. The first conference I attended in Southern California was, I was not a hypnotist yet. I was just looking into more of studying it for myself. So anyone can learn from a lot. I mean, some of the trainings are more for professionals. I teach a medical hypnotherapy specialty training that I developed many years ago, and it's always being updated. and changed. And that one is for certified hypnotists. They have to already have the basics because we're not teaching that in that particular training. But most of the lectures and a lot of the other classes are anybody can benefit from. And it's just a beautiful way to get around people from all over the world. I still love being in person. And to me, the best parts are between sessions, after hours, lunch, when you get lunch with people, and you just talk and kind of pick people's brains and hear all the good stuff.
Yes, in fact, that is where I met you, Patricia, in one of those conferences many, many years ago. And I have to tell you, it's the highlight of my year. Every year, I think of, before the convention, after the convention, it's like a big deal to me. And what's interesting is I completely agree with you. To me personally, the big deal about it, of course, I go to all the classes and enjoy them, but meeting the people there and talking to them and, what I call the hallway conversations, just what's up with this? How do you do this? To me, that is such a big, 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 because where else can you be in a bunch of rooms with hundreds of hypnotists? It's like, it's kind of a special treat for me. So I love going there. So it's May 1st through the 3rd. Is that what it is? The first week of May?
That's the actual weekend of the convention. And then they have pre and post conference extra trainings that people have to pay extra for. And my 2-day medical is pre-conference this year. And then there's other classes too. Some of them like for regression or some kind, little more specialty kinds of things usually. Also, they do certification trainings there, for people who want to get into the practice of hypnosis as well.
Hypnosis, fantastic. Okay, but the main chunk of the conference itself is from the 1st to the 3rd of May, with 2 days prior and 2 days after. They have other specialty courses. That's fantastic, and that's in Orlando, Florida. And I love.
They also have a virtual option if somebody can't be there, so that's nice too.
Yeah. If any of you listening to us right now can be there physically, my suggestion is be there physically. I mean, I think Zoom is awesome, but there's nothing beats like being in the room. And Saturday night, we do a big dinner. It's a big deal. It's kind of nice. So if you're interested in hypnosis, perhaps you want to get into the profession, or maybe just want to meet a bunch of hypnotists and ask lots of questions and see how we can help you, then going to Orlando May 1st through the 3rd would be a good option for you, because you can meet a lot of them. And as you're going to see today, there are 3 of us here today, 4 of us here today. You're going to see we approach the profession differently. We all take the same training, the basic training, but we approach it differently. You're going to see that today. So when you go into a room with a couple hundred hypnotists, you get a bunch of different ideas, which is awesome. So thank you, Patricia, for telling us that. Eugene, do you belong to any professional associations?
I belong to one of the association is it's Association of Hypnotists is one. Then the founder. I like if I knew that I would get this question, I would pull up that name. But the founder, he is a PhD. He has PhD in psychology, and he is a licensed family therapist, LMFT. So, and he does a lot of training on hypnosis, on medical hypnosis, on NLP too. I know NLP has love or hate among psychotherapists. So, but he is very into psychotherapy or in NLP and combining all of this together. So I belong to that association.
Beautiful. Lawrence, tell us about you. Do you belong to any professional associations? Do you go to meetings? What's your approach to the profession?
So I'm not a member of any professional organization just yet. Maybe soon. We're an organization that I am in. One group is the Irish Hypnotherapy Conference. And since you mentioned how wonderful it is going to conferences, I might as well just throw in that it's a conference happening at the end of April in Dublin, Ireland. And I do think people who are interested in hypnosis can go and attend it. But as I said, not a member of the organization just yet. There is talk of the Irish Hypnotists creating one for the purposes of Garda vetting, because trying to get Garda vetting in Ireland as an individual is really difficult. You really have to be a member of an organization to get it. So for that reason, a whole bunch of the hypnotists in Ireland are working to start to turn it into a company.
So you mentioned guard. What is the word that you mentioned? I didn't get it.
Yeah, I should mention that. Garda vetting. The Irish police are known as the Gardaí. So Garda vetting is basically police vetting in Ireland.
Oh, and
Yeah,
what, is there like
it's
a
just
legal
for
requirement?
working. It's not a strictly legal requirement, but it is something that insurance companies do want to look for if you're working with children or vulnerable adults.
I see. Okay. So we have similar, analogous things in the United States. In some professions, you have to do fingerprinting. You have to have like, in medicine, for instance, you have to do a full background check, and you have to do fingerprinting and that kind of thing. So we have analogous things. But what's interesting for you listening to us right now is, look, Lawrence is from Ireland. What do you make of it? So he practices it, and you practice in what city? Where in Ireland are you?
I'm in Limerick, Ireland, which would be in the southwest.
In the southwest of Ireland. Any of you listening to us right now in Ireland, if you want to have a conversation with someone there about hypnosis, Lawrence is your person. Fantastic. So, Lawrence, tell us, what is hypnosis? Somebody asks you that at a cocktail party. How do you answer that? What is it?
It's a way of speaking to somebody's background on the operating system of their brain. The part of the brain that's always working in the background that we're not aware of. Like if I ask you, what's your phone number? And you think about your phone number, well, where was that information stored before you started thinking about it? That's the part of the brain that hypnotists talk to.
Okay.
So hypnosis is just a way of talking to that part of the brain and using it to create changes. In hypnotherapy, it's to help people overcome smoking addiction or weight loss or anxiety.
What about that, Eugene? It's a way of talking to a different part of the brain.
Well, yeah, in a way, yes. But also for me personally, when it comes to hypnosis, is about focused attention. And my approach, well, how I approach hypnosis, I normally approach it with like evidence-based therapies. For example, I love working with parts. I love working in IFS philosophy, because we do have self that will never be damaged, or it never can be damaged, but we also have parts, and we also have shadow parts. And shadow parts is these parts that can't be recognized when you're talking to a client. Like it can pretend to be either a self or another part. But in hypnosis, you can unblend a shadow part from another part and actually have more direct access to those parts. And parts, like think about parts like a different personalities. According to IFS, internal family system, it's not pathological to have multiple personalities, multiple parts of our personalities in ourselves. So like it's quite normal. We're a little bit different at work, we're a little bit different with our loved ones, we're a little bit different when we're alone, right? And all those parts, they have a play. So with hypnosis specifically, you can more easily access those parts and maybe have a little bit deeper conversation, because it is, again, focused attention, and you can have quite focused work with particular part. Maybe the part that is like resisting, and also the parts in hypnosis can work a little bit differently, even though the person may not say anything, but a person does the whole lot of internal work there too. So that's my view of hypnosis.
Beautiful. I have a question for both of you, Eugene and Lawrence, and I have just a person to answer the question to us, and that's Patricia Scott, because one of the specialties that Patricia practices is medical hypnotherapy. So I want to ask you, Patty, specifically this question. I heard Lawrence talking about parts of the brain. And I heard Eugene talking about parts of the personality, which suggests to me more of a mental model as opposed to an organic model. Can you sort this out for us? Is it the brain? Is it the mind? Are they the same thing? Are they not? Can you get into that for us, Patricia?
To keep it real simple, I think of the brain as being the organic, as you said, part of the body, the human body, that the mind uses. And I always say, when you die, if they do an autopsy, they can find your brain, they can find the organs and the different organic parts of you, but they can't find your your mind. The mind is this abstract energy. It's like a spark that animates all the rest of it. In order to talk about hypnosis and how the mind works, of course, we make up different ways of speaking about it. We talk about parts, and that's nothing new. I've studied a lot of different things. Gestalt therapy talked about, ego state therapy. There's been a whole history of different ways of talking about our different personalities. And when we talk about conscious or unconscious or subconscious, I know some books break the mind down into like 5 or 7 different layers. And I just like to keep it simple because it's not like one of them's completely taken over and the rest of them just disappear. We're always in a fluid movement of consciousness that is moving. It's always moving. I've been talking about Tai Chi a lot lately. It's like a fluid movement. And when I talk about with my clients and with my students, I teach them the stuff that's in the books, but then I say, to me, when I say conscious, I mean what you're aware of right now, which is really just a teeny bit, considering all that's coming in through all of our senses in any given moment, especially these days. And when I say unconscious, or some people will use the term subconscious, but when I say unconscious, I just mean everything that's outside of your awareness. It's like your heart beating, like you keep breathing when you fall asleep even. There's parts of you, the part that has all your memories stored, like Eugene was talking about. We have this amazing ability to record things. I talk about it when I get a song stuck in my head that I've heard recently, and I don't even remember where I heard it. I can hear the entire orchestration. I can hear the background singers. It's exactly as it was heard. It's really a remarkable recording part of our mind. It's also our emotional part of our mind. And it's our creative imagination. So the part that's outside of our awareness. So when we can get all of the aspects of who we are, all the parts and all the layers of consciousness that we have available to us, when we get them all working in sync, in harmony, I think that's when we end up feeling what some people called the flow in the past. Whether you're playing a sport and you get into that mode, or whether you're playing an instrument or painting a picture or performing in some way, or just being in a park on a bench looking at nature. There's a certain synchronization that can happen. I think that's what people are really looking for when they come to us. They want to feel in sync with themselves. They want to feel like their energies are all integrated the way they're designed to be. Did I go off in outer space there?
No, you did awesome.
I do that sometimes.
That's awesome. Lawrence, Patricia explained something fabulous. She started talking about what people look for when they come to see us hypnotists. Lawrence, you're in Ireland, and I'm curious, why would a person come see a hypnotist in general? If you pick one, why is it that a person would go to a hypnotist? Is there like a common denominator as to why a person seeks a hypnotherapist?
Well, usually in my experience, people are coming in because a lot of people I work with are people who have anxiety. So they don't feel like Patricia said, they're not in flow because they've got this horrible anxious tension with them constantly. And that's one of the big reasons why they continuously come to hypnotists, because, well, they've got a problem. Hypnosis can help solve it. And usually it's because they tried a whole bunch of other things that unfortunately didn't work. Like I myself, I don't think either Eugene or Patricia have heard my story, but I used to have quite severe anxiety, and I ended up going to a hypnosis training because I'm also autistic. So I wanted to learn hypnosis for social skills. Went to hypnosis training, worked with a professional hypnotist at that training for the anxiety. Well, it's because I was miserable. I had this constant tension. I just was not happy with life in general. Just out of sync, out of flow. And that's why I went and got help from this professional hypnotist in this hypnosis class.
Yeah,
and that's what I see a lot of.
Yeah, that's beautifully put. Anxiety, that's a big one. I think that, especially in this day and age, when Patricia alluded to this, we have this overload of information, and there's this whole thing about FOMO, right? The fear of missing out. And since we are aware of so much, we're always also aware of what we're not doing or not experiencing. So there's this whole fear of missing out on everything else that's happening. Whereas in the old days, we wouldn't even know what's happening across the world. So nowadays, it's all real time. So I think that anxiety is definitely one of the big ones. I sort of summarize it in my own understanding. I think that people come to see us, that's just the way I look at it, to change the way they feel about themselves. Because even when we talk about behavioral modification, and I wonder if you agree with this, Eugene, when a person talks about behavioral modification, I want to lose weight, I want to eat less and exercise more, that kind of thing. Can hypnosis help me do that? Sure. But at the end of the day, they want to change how they feel about themselves. Because if they feel good, if they feel motivated, they will work out and eat less, and they will adjust their bodies. So to me, it all boils down to the way a person feels about themselves. And for whatever reason, we tend to feel somewhat poorly about ourselves for whatever reason. So things don't work out the way we want to, or whatever the case is. And so when we talk about mood, problems, depression, anxiety type of things, I don't use diagnosis in hypnotherapy. I don't use those labels. Some people do, I don't. But in general, what the person is looking to do is to change how they feel. Eugene, does that jive with you? Do you agree with that? How do you see that?
What I see with hypnotherapy on my side, specifically, as Lawrence said, often people come to us when they tried other things and like they didn't work. Either they went to like a doctor, or maybe they work with a mindset coach if it is more business oriented, or a business coach, or work with a therapist. And by the way, I do think talk therapy and hypnotherapy, they can actually go side by side together absolutely beautifully. It's not like one is not a competition for the other. But when people come to us, they usually hope for, like, yes, they want to feel better about themselves, but also they're looking for rather faster acting solution, because they've been suffering for so long, or they need a fast acting solution. For example, one of my clients, and it's nothing necessarily therapeutic, he had a interview with a tech company literally in a few days, and he did not have time to prepare. But he is a software engineer, so he has the skills. So we use ego states approach with, like, to jog his memories with like coding and what he was doing before, because those parts of the brain, it's in his memory. And he ended up actually winning his contract project. And but he couldn't really spend months or weeks with a career coach or with a tech coach to go through interview prep. And those are exercises really beautiful and needed, but like he needed something to really, like you said, feel more confident and really remember that like he actually has those skills, and those skills can be stored or manifested in different parts of us and different parts of our brains. And when we create those association in hypnosis, that can do quite impressive things.
Yeah, what a great explanation. Now, Eugene is a psychotherapist, correct? In addition to being a hypnotist. Am I correct on this?
I do have a background in clinical psychology and
Okay.
psychotherapy. I am licensed hypnotherapist in the state of Washington. I'm not licensed mental health therapist, just for
Okay.
legal purposes, but
No, I
I am
got you.
licensed registered hypnotherapist.
But he's trained in psychology and psychotherapy, which is awesome.
Yeah.
And that's why I love talking to you, Eugene, because you bring the whole perspective to us, and you keep us sober basically by putting some. And I love that. Thank you, Patricia. I want to ask you, how long does it take? We've been talking. Eugene brought up a really good point. people seek hypnotists because they think they can get results faster than they would otherwise. Before Patricia, I would add that the sorts of things I have seen, I've done about 45,000 sessions over the years, and some of the things I have seen could not be accomplished by talking alone, no matter how long you talked. An example recently is a woman who came to see me about 3-4 years ago, and this is somewhat common in my practice. People with premenstrual syndrome, very painful periods, younger women with very painful periods. And it's kind of a mystery because oftentimes medication does not work for that. They go to the physician, of course. They run a battery of tests. Then they tell them, no, everything is normal, tough luck, whatever. And recently a woman was telling me, she sent me a text the other day saying, that for the first time in her life, she's getting normal periods where she's not in bed for a week, that kind of thing. So in some of these cases, they spontaneously remember this uterine state. They remember living inside of mom's belly. It's not something that I'm looking for or suggesting. They remember that stuff. Now, is that a fantasy? I don't know. What I do know is that they tell me I'm in my mom's belly and I'm absorbing my mom's pain. Next thing you know, if I suggest to them, look, how about you release that? They release that. They tell me the next month the period was normal. I don't know. I don't have proof one way or the other, but they're the ones going through the period, the menstrual period, and they're the ones telling me that the pain was released. Of course, when there are no medical reasons, right? But I don't think we could get there, even if I talked to them for 20 years. I don't think we could have gotten to that level of release. I don't know. So to me, in addition to a potential difference in time, I think we can do things with hypnosis that we couldn't simply by talking. Patricia, give us some light here, elucidate us, sort this out for us.
Well, I think there's plenty of evidence now, especially in the medical side of it and the clinical side, that when you add, there's a lot of studies on adding hypnotherapy, for instance, to cognitive behavioral therapy or some other type of therapy that's more talk oriented, that it definitely improves and quickens the results. And, that's all out there and available. But I think it's because, like you were talking about, I'm not a labels person either, that. And I think that the thing that I love about the way that I approach this work is that it's that creative part of the mind that doesn't speak the same human logical language as sometimes what someone's conscious logical mind is telling them, or what some therapist told them, or some doctor maybe said something. The real core of the problem, I think, the way that we work is we get into that creative storehouse of all their memories and things that maybe happened when they were 5 years old or younger, or in the womb, like you were talking about. And without necessarily leading them to a specific thing that we might think might be the answer, or the root cause, we call it sometimes, to just open up the spectrum of letting their mind interpret it the way that's right for them. The very first past life regression experience I had with a client was unplanned, and I didn't intentionally take the person there. And this person, early in my career, luckily I had some good training in past life regression, and I knew how to facilitate it in an open way and asking questions. And this person got his answer in the strangest place that was a surprise to him. And he said, I know that was me. And I know I was a little boy, but I know I couldn't have been alive when that was going on. And so the nice thing is he got his answer. He didn't care. And I don't think it's our job to interpret or to give people advice or to try to say we know what's right for them. If we facilitate correctly, there's something magical about the state of hypnotherapy. It gets us into our smarter part of ourselves, however you want to label those things. And it allows the person to have the freedom to explore in their own consciousness, to find their own answers in a way that will make sense to them, that will feel right for them. And it's usually very metaphoric and abstract, and usually doesn't make out the most, to me, dramatic transformational work usually doesn't make any sense to the logical part of the mind, which is why we talk about this. There's a little dance of suspending judgment just long enough to let the person discover within themselves what their answers are. Because people come because they're stuck. but it definitely speeds up. And smokers, almost from the very beginning, 34 years ago, when I first started working, I was working with smokers in a single session because that's the way I was taught. And then I kind of updated my thing where I do a interview a week ahead and give them homework to do for a week, and then I do the session because I like 100%. But people, it's like they flip a switch, and people, for smoking is one of those things they've tried everything else usually. So what's the difference? It's because we help them actually change their identity and their belief systems. That affects everything, and the stress level is associated with everything that comes to us.
Yeah, beautiful. Lawrence, when I meet people in public and they ask me what I do and I mention hypnosis, the question of past lives invariably comes up. And I'm curious, from your perspective, Lawrence, particularly in being from Ireland, is what's your take on past lives? Are they real, unreal? Does it matter? Does it not matter? What's your take on the whole issue of past lives?
I don't really think past lives are real. I know there's a lot of people who believe in it, but I don't really suspect that past lives are real. And I don't really use a lot of past life and I tend to stay away from regression hypnosis. That's not really my thing. I don't really like the entire idea of having to make somebody relive a traumatic experience in hypnosis with a regression. Because, like, what if somebody got traumatized because they got hit by a car? I know somebody who got PTSD after being hit by a car. The last thing I want is for them to have to relive that experience. So most of my work tends to be content-free instead. As for past lives, I don't think they're real. I think that we all know that under hypnosis people can create false memories, and something vividly imagined, as your brain interprets it as if it was real, because a lot of the imagination parts overlap with the reality parts, so to speak. If you vividly imagine a spider, your brain will act as if there's actually a spider in front of you. Yeah. So I think that people vividly imagine false memories, and they think that they're past lives, but I'm not a believer in past lives.
Yeah. That's beautiful. So what happens if a person calls you up and says, I want a past life regression? You refuse to take him in, or do you explain, or how do you handle that?
No one's ever done that yet.
Nobody has asked you for one? Oh, okay.
No.
All right.
Can I add something quickly, Flavio?
Of course.
The gentleman who had these spontaneous regression or whatever, he didn't know what it was. I didn't say what it was. I didn't care what it was. He still didn't believe in reincarnation or past lives.
Okay.
And what I believe is unimportant. I think what I believe is unimportant. But he was happy. He didn't care. He said, I still don't believe in that stuff. But something happened when I was hypnotized and I got my answer. And that's all he cared about. So
yeah, I tend to agree with Patricia in the following sense, Lawrence. I mean, I also agree that what I believe doesn't matter to the client. But what I find powerful is the way I explain it to people is this. Look, when you and I go to the movies, we pay our tickets, we sit down, we go to the movies. We know it's fake. These are a bunch of paid actors pretending on screen. They're not really in love. They're not really mad. They're a bunch of paid actors, right? And yet we get into the movie, and to us it feels real for a couple of hours, and we get into the movie, the emotions of the movie. So it feels real during those 2 hours. I mean, there's a reality to that experience. When we walk out, yeah, it was just a movie. But during the movie, it feels pretty real to the degree that people get scared, they laugh, they cry. Why? Because we get into that other reality. And by getting into that reality, we also learn lessons. We also go through emotions. So I compare hypnosis to going to the movies, and I tell people that the best movie theater I know of is your own mind. And we can create different kinds of movie theaters. And I do agree with Lawrence, and I think that's a very important point to bring up. The mind will make up stories that never really happened. And I think that's something to be really, really aware of. And but if we slant the whole thing toward the improvement of the person's quality of life, and they just watched a movie in their heads, and from that movie they derive, like Patricia saying, some kind of conclusion, some kind of answer, some kind of understanding. I do think it's a beautiful experience, and I also know that not everybody will have that kind of experience for whatever reason. They resist, they don't believe, they think it's bogus, whatever the reason is. Not everybody will have it. But if the person sort of gravitates toward that experience. I don't oppose it, but I don't frame it like, oh, that's definitely reincarnation. I don't, to me, that's somewhat silly because that would be just my opinion. And regardless of whatever my opinion is, we can't even prove that stuff. And it's just, I don't think it would be useful, is my point. So, the theater of the mind, Eugene, you're trained in psychotherapy. Does that make any sense what I just said? Or am I just.
So well, a couple of things, right? It absolutely makes sense. Going back to the your client having experience that she remembers something when she was in the womb. There is a somatic psychotherapist and also IFS therapist, Susan McNallen, and she wrote a book, Somatic IFS. And in one of her exercises, one of her clients, actually one of the parts, remembers somehow being in the womb and experiencing prenatal psychological trauma. And it was actually proved by evidence that her mother was thinking about abortion. And in fact, because she was like, she couldn't be brave enough, or like she decided not to do it, but subconsciously or maybe even consciously, she would carry heavy stuff to have a miscarriage, and she somehow remembers that. So that's a fascinating stuff that you just like brought up with your client. About like past lives, I think it is like important to work in client's paradigm. For me, I study Kabbalah as a spiritual practice, so I'm welcoming the idea of past lives. But when it comes to hypnotherapy, like similar to Lawrence, nobody asked me to do like past life regressions. Normally, it's like people come with a very real issues, right, from this life, right? Oh, like I have a problem with my partner, or I have this chronic pain that doesn't go away. I have to go to regular massages. So can I do something with that? Or like I have an addictions at some sort. And when I say addiction, it's normally habits, right? Either it is porn addiction, or like smoking sensation, or mild marijuana addiction. I live in Washington State, and some people say, hey, like I would like to smoke less. I would like to be more focused on my work, that what I'm actually doing. I realize that I'm escaping something by engaging like in some sort of habits that I'm not happy with. But when people come to me, and I really hope they would, and let's say a person who is a very spiritually inclined and say, you know what, I really would like to connect with the creator and take this trip. It's kind of similar to Christian or spiritual counseling, because counselors, right, spiritual counselors, they will talk about God. And depending on their religion, they will bring those concepts to their counseling session. We can do the same thing with hypnosis, but it has to come from the client. And also, I think kind of similar to psychotherapy, if a hypnotherapist or hypnotist is not spiritual, or not comfortable, or not willing to do spiritual hypnosis, it's totally fine to say, you know what, I don't do spiritual hypnosis. I know someone who does, so I can refer you out if you want to have like profound spiritual experiences with your hypnosis. That's totally fine. And also sometimes people just, like Patricia said, sometimes people just like go there, like, you know what, all of a sudden I saw angels and I saw myself like in a different world, in a different time, and that was me, and that me has a message for me, and I think it's a breakthrough. That can happen, and I don't think we should resist that. We should just treat it as experience that person had in a hypnotic state, and that's perfectly fine.
I love the way Eugene explained it, Patty. We have to work within the client's paradigm, right? But he brought up an excellent point. Some conventional psychotherapists or counselors do faith-based psychotherapy, and then they introduce concepts that to other people might be extremely abstract. God is going to help you. And that's accepted within the context of faith-based therapy, conventional therapy, right? So by analogy, what he's saying, if I understood you correctly, Eugene, is that, okay, we can work within the person's paradigm, and if they are into this spirituality idea of past lives or reincarnation, we can perhaps use that. And I think we're all in agreement here that we should work within the person's paradigm. And if we're not comfortable, I love the way you put it, if we're not comfortable for whatever reason with the person's particular paradigm, their way of looking at life, right? If a person says, I want to work with you that way, and it's not the way you like to work, I think what Eugene said is awesome. Say, look, I don't quite do it that way, but I can help you find somebody who does. And I think that's the honest way to handle that kind of thing. And I'm sure, right, Pat? Would you agree with that, Patricia? I mean, if
absolutely, yeah. I've always advertised, even before the internet came, of course, when I started, that I do clinical and medical hypnotherapy. I wanted that to be my focus, but every once in a while somebody will call and say, I want to do a past life regression, and somebody told them hypnotists do that stuff, so they would call me, and my next question would always be, for what purpose? Because I'm trained in a lot of things that I don't advertise. I contributed to a Roy Hunter book called The Art of Spiritual Hypnosis. I don't advertise that, but it's in my bio if somebody reads the whole thing, right? I know I want to be able to address things that like you said, the way I look at it is, as long as I'm ethically and morally okay with what the client is asking me to help them with, I'm going to let them make their own interpretations and make their own like you said, step into their world, because their mind knows how they need to have an experience to help themselves. Yeah. So if somebody just wants to play because they saw a movie about past life regression or read a book and they just want to play, I do exactly what Eugene said. I said, that's not really my specialty. I work within the realm of the medical for that, but sounds like you just wanted to, and I know this person. This is why it's good for us all to know each other's specialties. And I have a couple of go-to people that I'll say, I know someone who all day and all night does past life regressions. You're going to love this person. And they're going to really respect you for sending them to someone that's their specialty.
I agree 100%. And it goes back to the person's paradigm, like Eugene explained so well. I have a quick anecdote. I'm reading a book right now about the history of quantum physics. And when they started doing these experiments over 100 years ago, and it evolved into this idea of entanglement, the idea that subatomic particles, when they're separated and you stimulate one, the other one responds. Now, this has been shown in laboratories and stuff, so they call this action at a distance, and how can this one particle over here influence the particle over there across the world? And they, people debate this, but it's in the physics textbooks. It's a phenomenon. It's called entanglement, and it's there. So in this book about the history of that stuff, one physicist, it's a true story apparently, was showing those calculations to another physicist, and the second person says, "Oh no, I would never believe that stuff, even if it were true." And I thought it was such a good, I would never believe in that, even if it turns out to be true. I don't believe in it. I think that's such an interesting phrase coming from a physicist, coming from a scientist. I wouldn't believe in this, even if it's true. Because it's, I don't know. I found it humorous. I don't know if you agree, but I think that all human beings, hypnotists included, we tend to, at some point in our lives, kind of crystallize our own beliefs, and then we believe a certain version of the world and a certain version of what life is all about, and then things like that can happen. I wouldn't believe, even if it's true, so I think we are not immune to all of that. And Lawrence, speaking of, you mentioned a moment ago that you live with autism. Did I hear you correctly?
Oh, yeah. Yeah, I'm autistic. I am the autistic hypnotist.
Yes. So tell us about, okay, and that was I wanted to get into this conversation with you. So what happens? So is it difficult for you to change your own mind? How do you? What is it like to live with autism?
I mean, it's not that difficult for me to change my mind. If I want to change my mind, I can change my mind really fast if I want to.
Okay.
As for what it's like to live with autism, it was pretty difficult growing up because I had no clue how other people worked. But as an adult, because what I have is Asperger's syndrome, the high functioning autism. So as an adult, I consider it to be a superpower that I can get really obsessed with something and learn it really fast, and I consider that to be brilliant. And to be honest, everything has its ups and its downs, but I'm not really sure. How specifically do you mean when you say living with it? Is there any specific parts of just life in general?
I was just wondering if you would be willing to share what your personal experience with it is, because from what I read, it's becoming more commonly diagnosed. Am I correct on that? Are there more diagnoses recently?
I say more diagnoses, but I don't think it's becoming more common. I just think that people are diagnosing it more. I think it's
Okay.
always been there. It's just that people didn't really put labels on it. You would have said in the past, oh, this guy, he's just quiet and bookish, or he's
Mhm.
he's a bit quirky, but you wouldn't have had a label like autistic to put on it. So I don't think that there are more autistic people. I just think that it's just more diagnosed.
So let me ask you, is it possible to not be autistic anymore? If a person is autistic, can they somehow not be autistic anymore? Does that exist?
That does not exist. No, no,
Okay.
it's entirely neurological in how the brain is structured and wired. So you can't be not autistic. Now, there are some things you can do that can help somebody become more functional. I've seen a lot of people who are low functioning autistic move up to a more middle functioning. For those who don't know, there's actually 3 levels of autism. Level 1, high functioning autism. Level 2, middle functioning autism. High functioning, you don't need a lot of support. That's me. Middle functioning, you need a bit of support to get along with life. Level 3, low functioning autism. And in low functioning autism, you need a lot of support. I think that people can move up to higher levels, but you'll always be autistic.
And the question is, can you help a person move up on that scale with hypnosis?
To be honest, I do suspect it's possible. But the reason I'm using the word suspect is because I haven't specifically worked with them for that exact thing. Now, I've worked with people for anxiety, and they certainly feel a lot better, because one of the things about autistic people who get anxiety is that, unlike normal anxiety, that autistic anxiety ends up linking into other areas of their brain, into other aspects like hypersensitivity. They get anxiety. If they're hypersensitive to noise, the noise can trigger anxiety. If they're hypersensitive to light, the light can trigger anxiety. Social problems, the social difficulties that autistic people usually have, they get anxiety over that. Normal neurotypicals would be, I'm terrified of what people are going to say about me at this party. I'm scared of being judged. Autistic people tend to make it even worse with, I know I'm going to be judged. I know it's going to be bad because I'm so much different than everybody else. So I'm going to wear a mask, and that's going to be exhausting. On top of that, when it comes to autistic people and anxiety, one of the traits of autism is that the brain, or the amygdala specifically, is slightly larger and more reactive. So in that sense, an autistic person can go from 0 to 100 really fast, depending on their brain structure, which is why autistic people also get famous for the autistic meltdowns as well. Now, I think that there's a lot of things that hypnosis can help with, and because when you get rid of trauma and anxiety, the chance of having a meltdown go way down. The chances of just having more emotional regulation can help somebody move from being low functioning to more middle functioning. And I do believe that with hypnosis, I do believe that it's possible for somebody to become so functional that there are people who can't tell, because you've told people that I'm autistic, and there have been people who should not believe that I was. So I certainly think that hypnosis can definitely work with autism, if that answers your question.
Yes, beautifully well. Thank you so much for that, and thank you for sharing about your life. I do not have any experience. That's why I'm asking. I don't have any experience with autism, and I'm curious about it. And that's why I asked. But I would imagine, again, I'm completely speculating. I have no experience and no knowledge of it, but I would imagine that it should be possible to help a person move along that scale that we discussed, to low function, to middle function, to high function. It should be possible. And you sort of alluded to that. But I have never done it. I have never worked with a person who has autism or anything like that. So, Patricia, you do medical work. Is that something that you have done?
Yeah, I haven't worked specifically with autism. I know some other hypnotists and students that I've had that say they do. But with the new science, the neuroplasticity, and the fact that we know now the brain is constantly changing all throughout our life, there's been enough studies now, and I've worked with people that have had strokes and other types of brain injuries that, through the last few decades, they know now that you can recover and retrain different parts of the brain to take over whatever the function was. So I don't know. I tend to, when somebody says something's impossible, that's what got me into this field when I was 19. I had a doctor that I had a back injury that was telling me all the things I'd never do. And if I had listened to that person, I would have ended up with a lot of surgeries and probably be in a wheelchair for the rest of my life. But it's to me, this work can always do things. And if we can just get the stigma of what the belief system, again, that our client has surrounding what they're bringing to us. I feel like if somebody comes to me and says, I know the doctor told me this, but I think I have a feeling inside of me that I might be able to do a little more than that. Now, I'm not going to, go outside of my scope of practice, but as long as I have that medical referral to add hypnotherapy, I'm going to trust that person and go with their intuition, their gut instincts, whatever you want to call it, and do some exploration. And I don't ever know a time when they weren't able to do more than maybe what they were led to believe, because belief systems can inhibit you from doing certain things because you've been told by everybody this isn't possible. So I tend to blast through that and just say, well, they might be right. I don't know. But let's see what happens. And it can't hurt for sure. It almost always does more than people expect. And even the doctors, I always say my favorite thing is to have doctors be flabbergasted at what either I did or one of my clients.
Yeah, that's a great way to put it. And I think that in some cases, Eugene, I'm curious, I think sometimes it goes the other way around as well. I think sometimes a person comes in and says, I know I can't do this. I want to, but I know I can't. I know I cannot stop smoking. I know I can't lose weight. I've always been fat. Everybody in my family is fat. There's no way I can lose weight. I think that in some cases, it's sometimes, like Patricia said, they come in saying, I know I can do something, right? I just don't know how. And I think that's awesome. The person's so motivated. But I have also seen cases in which the exact opposite happens. I know I can't, and I say, "Oh, let's just go to work. Let's just take one step and see how far we get today." And sometimes a person overcomes amazing challenges. What's your take on that, Eugene?
So, I want to go back a little bit to autism, because I do have direct experience with children with autism specifically, and adults with autism, not necessarily as a hypnotherapist directly, but there is an interesting there's an interesting data that I have from working with my former clients with autism. One important part of people who live with autism is self-regulation. And I think self-regulation is good for all of us, but especially for children. And hypnosis, it doesn't have to be like this, like direct experience, like sit in the chair, close your eyes, like I will count from 10 to 1 and you will go to your self place. Sometimes especially with like people with certain condition, you can what I tried before with low people on the autistic spectrum who are low functioning, they will never sit down in a chair, like close their eyes, like they're way overstimulated by everything else. What helped me before is like changing my voice. And I don't know if you know the concept of hypnotic voice. So when your voice changes and you say, "Hey, we're gonna let's say we're gonna go outside," or like let's say the bathroom break is done, like, "Hey, the bathroom break is done in 5, 4, 3, 2, 1, all done." And it's like they're under a spell, like, like the person, like, just like, "Oh, all done." Also, like, for neurodivergent people, for us, like, I have ADHD, for us it's important to have a deadline. So if you just say, "Hey, like, get out, we need to go," it's just overstimulating. Like, "Hey, in 5 seconds you need to be done, you need to be dressed, and we need to be moving, and you're firm and calm, and you have this like very like calming nature." That has tendency to help with those with autism. What I see to be very interesting and helpful, again, going back to self-regulation, is like after the session, so they have like maybe recorded hypnosis recordings that they can use, and like you can negotiate with your client, do you want to binaural beats with a recording, because for some people it is very overstimulating and distracting. For others, this is what they really enjoy, this is something that they like, and they can use that recording on everyday basis, and that can be extremely helpful self-regulating tool. And kind of going back to your initial question, like when people say I can or cannot do, I think it is like it is when I hear that, I always kind of going back to behavioral based questions, like I'm looking for the evidence, right? And we can drill down the evidence, right? Let's say like, "Oh, I cannot do it, it's not possible for me." And yes, person can find evidence like, "Oh, it's not possible." And then I go the other way around and I say, "Hey, but have you ever had the evidence that you didn't think that you will succeed, but you succeeded, even if it is a small one?" Like, you don't have to aim for anything big. Like, let's say you didn't think that you can do 5 like pull-ups, but you actually did 6, something like that. And um it's all about reframing. And also, sometimes it is okay, and like that can be controversial opinion, sometimes it is okay to just let person to be with this feeling that I can't. And because like sometimes you are encountering that part that will protect, that will resist, and person is actually enjoying more resisting and saying that I can. And that's what I feel like, yeah, like, you know what, be with it, like tell me how it feels to just be with it. And when per person is not being convinced that they actually can, like then something shifts and person starts like thinking like, "Oh, do I want to be with that? Like, do I want to be with this sense of that I can?" Like, and now it's just me, like nobody's trying to save me, like that's up to me, and then sometimes it can help.
Beautiful. Lawrence, I want to ask you, Eugene mentioned on a few occasions this idea of self-regulation, and he indicated that that's potentially one of the difficult aspects of living with autism. Do you find that to be one of the challenges? And if so, can you tell us what self-regulation is? Somebody hasn't heard that term before. What is self-regulation?
So self-regulation, from my understanding, that would be more basically regulating emotions, regulating all those different feelings in your body, because every emotion creates a physical sensation in your body. So from my experience, I can tell you a story real quick, that one day I became, I can't tell you the exact, what happened was a victim of a crime. I went to the police station. I went and the police had to take police statement. I was sitting here, and as you can probably imagine, being in a police room, getting and having to give a statement was rather stressful. So while the officer on the other side of the table was taking out his piece of paper and getting ready to take my statement, I just closed my eyes, imagined all the tension in my body, what direction I was spinning, and started spinning around the other direction. And just using the power of my own imagination, he didn't notice a single thing when opening, and then after a couple of moments, the tension was gone. So that's one thing that I will do with self-regulation, but it's all about managing the feelings in my body, managing all the tension.
Wow, that's so interesting. And I God knows I've had my own share of problems with self-regulation, anger or different types of, it can be very, very difficult. And I would imagine that if on top of that, there are some neurological patterns that might be a little bit different, I would imagine that it might be a big challenge for a person living with that. And like Eugene mentioned, and I think you alluded to as well, if a hypnotist can help a person. So we moved away from the idea of curing autism. You explained to us that that's not something that happens, but you did say that it is possible potentially to move the person up that scale of functioning. And as Eugene explained, one of the issues that goes in that is this idea of self-regulation. So I can identify with that in the sense that I've received help from other hypnotists with self-regulation, even outside of the diagnosis of autism. And so I would imagine it would also work for those who are neurodivergent, and it would be a great tool, a great addition, a great help, I think, for if a person is struggling with that. Patricia, I'm curious, when you talk about medical hypnotherapy, what are you talking about? You're talking about curing illnesses? What exactly what's in the scope of medical hypnotherapy?
Well, as far as legally and ethically, it just means that being an unlicensed hypnotherapist who has studied psychology and philosophy and a bunch of other things, but I don't have the licenses in those fields, that I get a referral from the person who diagnoses it. So somebody diagnoses a person with either a mental, emotional, physical, or some combination of that, something that's in a book somewhere and puts the label on them. That's when I would get what I teach is those kinds of things. The things that we don't diagnose, we don't treat, we don't diagnose, we don't prescribe medicine or any of those things. We help as part of that medical team to be adjunct, to bring in another realm of the part of the mind that hypnotherapists know how to talk to. That other aspect, depending on the person's belief systems. Again, it could be their spiritual side, it could be their God mind, it could be their inner wisdom, it could be anything, right? That we are able to get to some deeper layers of what really is at the base, which is why sometimes things like IBS, I know I've had some experiences with people with IBS that had it for decades, that it was once they added the hypnotherapy to whatever treatment they were doing, it was cleared completely. And, it's just, we can't guarantee, we don't promise anything, and you don't know from one person to the next. And then there's always misdiagnosis as well, right? So taking a person and whatever they offer, their belief systems, their attitude, but that self-talk, I always say, if they're saying, I can't do this, but they just paid me to help them do it, then, if it's something like smoking or weight or something like that, you can always say, you're actually hypnotizing yourself through repetition by saying that all the time. Your creative part of your mind, your inner mind is just thinking that's the way it is. So the reframing that Eugene was talking about is so important. And again, stepping into their world, seeing what is it they want. And the medical side is just, again, anything that could or should or might be diagnosed. I don't go near the line of the licensed people. And then it's about, we can help with it. If they're taking medication We can actually help their body to process it better, help them to sleep better, help them to deal with all the self-regulation, all the things you're saying, to be able to deal with whatever treatment they're doing. And with like chemotherapy and radiation, it's been for decades now. Mayo Clinic's always recommended hypnotherapy to help with those side effects of those things. So it's it helps with attitude and self-esteem. Like I said, a lot of people that have a medical issue, they feel guilty. They feel like they're letting their family down, or they're being a burden to someone. Those are the emotional things that we can work with hypnosis to help them to work through those, to feel more that they have at least some level of control over their part in whatever the treatment they're getting. Did that answer your question?
That's awesome. Yeah,
and I know there's some places you don't need a referral. I always want to get a referral, though, even if it's not required.
Yeah, a couple of comments. I was at an oncology conference about 3 weeks ago, and just like Patricia said, hypnotherapy is one of the modalities that is recommended for patients who are undergoing cancer treatment of various types, radiation, chemotherapy, and surgery. Those are very traumatic experiences for a person because it changes your life completely. And so hypnotherapy is definitely one of the things that they recommend. That, in other words, this was a conference for physicians, but the recommendation is that physicians advise their patients to seek a hypnotherapist as an adjunct modality. The framing is not that we're going to cure cancer. That's not the way they frame it, and I wouldn't frame it that way either. But to help the person deal with the side effects and the consequences and the emotional toll that an illness of the magnitude can represent to the person. Like Patricia said, they feel that they're disappointing their families. Maybe they cannot work. It's a big deal. It changes a person's life. So if we can assist in the process, that's awesome. But and just to wrap that up, I was thinking, if we can help a person not consume too much alcohol, not smoke too much, and adjust their weight a little bit, just those three things alone, in a sense, we're already practicing medical hypnotherapy, because we know that those three things, particularly if they occur together in the same person, if a person's a heavy drinker, heavy smoker, and if they're obese, those three together, we know medically that it's going to deteriorate their health greatly. So each one of those risk factors that we can help the person decrease, we're definitely helping them improve their health by a measurable degree. And this is not data coming from the hypnotherapy community. This is data coming from the medical community. There's no question about that. Obesity, alcohol consumption, and cigarette smoking, those are big deals. So, and hypnotists tend to be really good at that. We can help you quit smoking, we can help you not drink, we can help you lose weight, those kinds of things. And we're definitely going to help them with their health. Eugene, I wanted to ask you about mental health. What about the person who has a mental health diagnosis? And I'm not saying the person who is a little sad. I'm talking about the person who perhaps has borderline personality disorder, or maybe they have perhaps even schizophrenia, or some type of mental health diagnosis of that caliber. What would you say as a hypnotist? Can we help them? What's the story there?
So the general statement is like, yes, and I think it is very unique. I work with two clients who had a diagnosis of schizophrenia. With one client, I did not do hypnosis. I did motivational interviewing and more like spiritual counseling, because that's what he was bringing up. And the other client, what we did, almost every single session is either grounding or hypnotherapy, majority of the session. And I explained why. One client that I did not do hypnotherapy and instead was doing more like motivational interviewing and more like a spiritual counseling in a way. He was experiencing very intense hallucinations. And it was very hard for us to catch him on a good day when it was sort of like a break where he was not like super overwhelmed. Normally it's like, hey, and you know, like people who are not familiar with schizophrenia, like he was well aware that it is hallucinations, but it doesn't remove the intensity of the experience. It's just like, yeah, I know it's probably not real, but if devil is like chasing me and is trying to kill me, like I don't know why I'm experiencing this. Maybe because I did something, maybe because I'm not good and things like that. And I only didn't do hypnosis because I didn't want to harm him even more, because he was fairly new to me, and I was unfortunately we didn't have a chance to work for a long time. But like for me, before we even go to hypnosis, it was very important for me to stabilize that person, that the person is in a stable like condition, because like I've seen that person being like in psychosis, in active psychosis. He was not violent or anything like that. It was just, and he knows that he's in psychosis. Sometimes he's like, Eugene, I don't want to be counseled. I'm having really, really hard time right now. And another client who also had schizophrenia, we did every session with of hypnotherapy, and it was a stress management tool for her, because also what is important to understand, people who are going through mental health illness, like severe mental health illness, is a lot of stress. Like you have to manage your medication. Medication might have side effects. Also, let's say you are on a antipsychotic medication. And it's not that antipsychotic medication will remove the psychotic experience. It's just like you're not going to be as reactive to your psychosis. You know, like you're going to be a little bit more calmer. You're not going to be as reactive, and it added a lot of stress for her. And on top of that, like personal situations, like personal stressors, and it was so transformational for her, like in a way that like coming up with a way to manage or cope with the auditory hallucination with voices. So like, oh, I can actually negotiate with my voice. Like it actually listens to me. I actually can tell like, hey, can you be a little bit more quiet right now? In a loving way, you know, like without aggression, like, hey, I understand you want to say something, and it's probably really important what you're saying right now, but you're distracting me so much. Can you please be a little bit quieter? And it helped. Or like when it's like overwhelming her, like she would say, hey, you are overwhelming me right now. Like, can you quiet it down? And normally, sometimes in hypnosis, we would like go to those moments and like, oh, it's actually my like a part that is like 14 was trying to tell me about my experiences, and like not voice did not make any sense. It's just like it's just voice that like says very compulsive things like that don't make sense, right? But then in hypnosis, like, oh, like that's what it was about. And um sometimes we would have those dialogues. So like, can you tell that 14-year-old what does she need? Like what can you do for her right now? How we can change that experience? And that had a tendency to help. And that was a great stress management tool for her. And like her psychiatrist was actually quite impressed. He said like, well, I was nervous about like hypnotherapy for people with schizophrenia, because like I didn't know how she would react, or if it would trigger like psychosis, or would put her in the worse psychosis. But actually like reconciling her internal world, her like auditory hallucination and subconscious mind, and that it's not necessarily saying like, oh, I'm cured, like I don't need medication. It's rather managing the symptoms and reducing the stress.
Beautiful. I love this conversation because here we go, folks. Just as promised, you know, different points of view, different opinions, different approaches to hypnotherapy. And we covered such a wide breadth of topics. I mean, we talked about everything from a convention to schizophrenia. It doesn't get any wider than that. This is absolutely fascinating. Patricia, 15 seconds. Tell me one thing you really appreciate about Lawrence and something you really appreciate about Eugene, please.
Yes, I love meeting Lawrence, and he's got a calm gentleness about him that just makes me really intrigued with what's going on in his. He seems to be very, very methodical about how he puts his thoughts into words and expresses himself. I just applaud you for coming from a place where you have a very unique background and understanding that you bring to certain people that would come to you. That is something that I wouldn't be able to even relate to, and I really respect that, and that's why I like that we all have different backgrounds. And Eugene, every time I hear you talk, I'm enjoying more and more your breadth of background and knowledge about the different aspects of the mental health side of this and the psychology side, because it intrigues me now.
There you go, Patricia Scott. Eugene, tell me one thing you really appreciate about Lawrence and something you really appreciate about Patty.
I really appreciate about Lawrence that he is very open where he stands with hypnosis, with his approaches, with his beliefs. I think it's important. I sometimes see a lot of hypnotists on certain things a little bit wishy-washy, it kind of depends. Like Lawrence has his boundary, and I think it's so beautiful, and also bring that unique experience being neurodivergent in hypnotherapy. I think it is quite unique experience, and especially having lived experiences with certain things that he is helping people with. And Patty, always, it's the second time us meeting together, the breadth of knowledge and just experience with medical hypnosis. I also watch your YouTube channel, Patty. You always bring so much insight. So I really enjoy seeing and meeting people who are in hypnosis for a long run, right? It's not a hobby. They're not just a coach that certified yesterday, have no background in hypnosis or mental health, but actually people who put the work in this field. So I think it's quite phenomenal.
Awesome, beautiful. Lawrence, you joined us today. We want you to have the final word on the program today. So it's all yours. However you want to close the program today, it's your closing. So we're all yours.
Well, first, I'd just like to say thank you so much to Patty and Eugene for those wonderful words, for those very kind words, and of course to you, Dr. Flavio, for having me on. I'm not sure, is there anything specific you want me to say to the audience?
I mean, I just want to say that I'm so happy that you're here and joining us and participating and adding your knowledge, your experience, your wisdom to our understanding, of hypnosis and also of life and so forth, And I think the people listening to us right now definitely enjoy hearing from you because like they both said, Patty and Eugene, you bring a unique experience to the field of hypnosis. Man, I really appreciate you, and I appreciate you being here. And if I may say so, I am so proud of you because I can imagine that another person, hypothetically, a person would say, well, I can't do much because I live with this condition, whereas you turned it all around and you're helping people, so you have nothing but my admiration. I think that you're awesome, and you're my hero, man. Thank you so much for being here. And Patty, I have no words to describe. Like I said, I've known Patty for 30 years, and she's the person to go to. If you guys are listening to us right now, you have questions about hypnosis, when you're all done with your research and you want the final, story on it, talk to Patty. She'll tell you what's going on because she's been around and she knows her stuff. She knows her profession. She knows her trade. She knows her, her craft really, really well. And she mentioned in the beginning of the program that she's going to be in Orlando. I'll be there as well. And she's going to be doing classes. It's going to be the last few days of April, first few days of May. And it's going to be a great experience for you to meet other hypnotists. If you're in Orlando, Florida, Patty is going to be there. Eugene, are you coming down to Florida?
No, I don't think I can make it this time, but it sounds really exciting. I'm in Washington, so it's
Yeah, I know.
like across the country.
Yeah,
With
I
the
love
with the
Washington.
flights right now, it's kind of challenging.
Yeah. No, I get you. I get you. Eugene, I really appreciate you being here. You bring a voice to the program that I think is wonderful. You're credentialed, you studied, you know psychology, you know the mind. And I think that adds so much depth and richness to this whole program, because you bring wisdom, you bring knowledge to this whole conversation. So thank you so much for being here. Really appreciate all of you. Thank you. Can't wait to get together next week again, a whole new set of topics, and we're going to learn something about hypnosis. So thank you so much for being here. I'll see you all next week. Thank you.